Hello, my name is Anna Kinder. I'm the Executive Director of the Casper-Natrona County Health Department. And today, I wanted to provide you for some updates that we have going on in our community in regards to COVID-19. 3 weeks ago, Natrona County had 178 new cumulative cases in 1 week. 2 weeks ago was 228, and last week was 341. Our current total case count on Monday was 1,388 with 300 probable cases. Since this is Thursday, we've had a significant increase in those as well. As a county, we were the highest for the week last week for all counties in the state. Our state has seen their highest count overall for new lab confirmed cases every single day. The number of tests that they're receiving and processing and are testing positive grows exponentially every single day. Last week alone, they had 2,185 cases total. Our positivity rate is well over 20% in our community. Currently, we have well over 200 cases that we're working with contact tracing. Working every day until very late hours, the sheer number of cases that come in every single day continues to grow as we try to do our best to get through as many as we can every single day. We even have engaged the National Guard to help us, as well as some cases are turned back to the state, always trying to get as much done as we possibly can. But the biggest thing that concerns me is the impact on some of our resources for Natrona County. We have well over 175 positive residents in long-term care and assisted living facilities. In this week alone, we went to 5 different sites to do 100% testing, which was well over 500 people. 85 staff are out of long-term care and assisted living. They're not able to provide the work. Some of you have asked why they're getting infected if the nursing homes are locked down. People have lives that they do outside of work. People become exposed going to the grocery store, going to restaurants, being with family and friends. 4 residential and communal living facilities have seen more than 10 deaths in the last 15 days, and we anticipate 8 more or even more than that we don't know about. There are 250 healthcare workers on modified quarantine, allowed to work because there's no one left to do the work. We have more than 50 essential personnel that are on isolation because they've tested positive. They're not able to do the work either. This includes your police, your fire, city operations, county operations, refineries, everything that we need to keep the city going. All of this does not include our hospital, our school district, and college, and they'll be talking in a different video about that. Some people are dying alone due to the shortages of staff that they have available. There's no one able to really sit by their side in their last moments. Some, they may have one nurse for multiple patients, and the need is great because there's just no additional staff available. Our hospital is full. We're not able to transfer patients in and out of the hospital like we have in years past. They may not be strong enough to endure a trip to the hospital. So always looking for who and where we can make sure that people are at their safest, which often means they can stay in their long-term care setting. Our physicians are having to make extremely hard decisions and conversations with their patients to tell their loved ones and their patients that they may not make it through COVID-19. There's nothing else we can do with them, and it is not always those vulnerable populations. At times, it could be just someone in their 50s who has no other disease. We work with over 14 sites to ensure that they have the care that they need for testing. That is our priority at the health department at this time, is that we will just be working very hard to do testing in all of these 14 sites for symptomatic patients In addition, we do surveillance testing with multiple sites as well, where we're projected to do over 6,000 tests between now and December 30th. People are going to work sick, thinking it's the common cold, allergies, smoke, anything like that. However, it turns out that they're positive and they've just infected their entire office. So what do we have but oftentimes leaving a whole workforce out of particular departments that aren't able to fulfill what is needed to be done? Traveling to other cities, states, does put a person at additional risks. You actually can go on the CDC website and identify places that they recommend that you do or not to travel to. And we maybe become one of those sites that people won't want Wyoming to come into their site as well. We have a lot of testing technology available to us at the health department. I have multiple partners throughout the community that do rapid tests, PCR tests through the state, as well as other testing technologies. We at the health department have the ability soon to be able to provide rapid testing from the state, surveillance testing, and routine testing. On Monday alone, we tested over 500 people. People are reporting very sick and the schedule is full, and my partners will tell you the same story. Someday, we'll have a vaccine, but that's a long ways away from now. It's not an option in our immediate future. We anticipate this will go on past the holidays. We might see increased cases due to the holidays where people are coming together in close spaces, as well as the weather forcing us inside. The most important thing is to think about what we can do for our neighbors, those that care for us, and our community as a whole. What can we do to help slow the spread of COVID-19? I know the vast majority of the population can survive and will do extremely well with the virus. What I'm asking for you is to consider the transmission to the next person that you come into contact with and who they may come in contact with. All it will take is that personal responsibility to not spread the virus to the next person that you interact with to slow the progression. People are dying, and I know we will at some point all die, but I want to ensure that I protect the public's health to the best ability that I can in any way possible to prevent a surge in our hospital that would cause you not to have the care that you need after a broken arm, a car accident, or even a heart attack. To ensure we don't have to have immediate cremation and burials without services due to no space in our funeral homes or morgues, or that we do not have to move to any other harsher situation that will prevent us to continue to function and thrive in Natrona County. It is very difficult to complete the work when we don't have the personnel to carry out the work. So I'm asking that everybody can do their part, all of the masking when you're within 6 feet of someone else, hand washing, and just keeping that 6-foot distance. It's a step in the right direction. It is our only means of prevention at this time. Thank you.